So the overwhelming majority of cartilage damage in the ankle cases are because of trauma, means injury. Usually that's a single severe ankle sprain or a fracture. Sometimes it can be due to repetitive, what we call micro trauma. So that's a series of small injuries caused by having a slightly unstable ankle. Sometimes, occasionally, especially in younger people, there's a condition called osteochondritis dissecans, which is caused, we think, by a lack of blood flow in the bone, and that can cause damage to the bone and surrounding cartilage even without an injury. So that's really from what we call the history. So that means the story that you give us and the symptoms or the things that you feel. And many people often get a slight damage during an ankle sprain, which may or may not be significant. And it's not always a concern because even if you get a little bit of scuffing of the cartilage, if it heals in 6 to 8 weeks, that's fine. But if you find that you're getting a deep aching pain, especially inside your ankle or the joint months later, or you get locking, clicking, catching, then it suggests that one of the flaps of cartilage is maybe slightly bigger, or there's a flap that's getting caught as you move the joint. And that could be a sign of a more significant injury. So it's an area of a bit of controversy because there are a lot of options and there are various evidence-based algorithms you can go through, but ultimately it depends on where the cartilage damage is and how big it is. So we always want to do the least possible, but what's effective. So for smaller lesions, there's something called microfracture or bone marrow stimulation, where we go and drill tiny holes in the bone and it allows some of the blood to come up and form a little scar tissue on top. And that's not normal cartilage, but for small lesions, that's probably fine. But if you have a bigger lesion, you really want good, better quality cartilage. So you have an option of taking little plugs of bone and cartilage from elsewhere. So for example, your knee, and putting them in your ankle, or taking an artificial or synthetic membrane made of a substance called collagen or hyaluronic acid and trapping some stem cells in the cartilage defect to try and grow normal cartilage again. So the answer to that really depends on what we do. I think ultimately trying to get cartilage to heal takes time because it doesn't have a great blood supply, and you really need to protect it while that's happening. So if you are having an operation where we're trying to regenerate cartilage, then perhaps 4 to 6 weeks, you might have what we call protected weight bearing. So you'll need to be in a boot, and although you can put some weight, we don't want any movement of the ankle because we don't want shear forces. And then after that, it really depends. If you've had, for example, the microfracture I talked about, then it may be up to 6 months with no sport. But if you have a more involved procedure with a bigger lesion, it may be up to 12 months that we don't allow you to do any impact sport. So again, it depends on where it is, how big it is, and the kind of other factors such as how old you are when you have it, etc. So if you have a small lesion, which isn't in a place which is getting caught all the time and doesn't have a flap of cartilage, then it can sometimes fill in by itself with scar tissue, or it might be in a place where it doesn't cause a problem. But it's not going to form normal tissue in an adult. But if it's a bigger lesion or it has a little flap of cartilage which gets caught every time you move your ankle up and down, then that flap can get bigger. Now, the thing is, we don't know for sure which ones are going to get bigger and which ones are going to develop arthritis, or if they develop arthritis at all. Sometimes patients can have big lesions with no symptom. So ultimately, we look at how it is and we look at how it's progressing and follow people up, and then we get a better steer of what's going to happen next.